This video will provide an outline of postoperative care, including its definition, purposes, and phases. Postoperative care is the care a patient receives after surgery, from the operating room to the recovery room and home. The purposes of postoperative care are to reduce postoperative mortality and prevent, detect, and manage complications. It also enables successful and faster recovery, provides quality care services, and promotes wound healing. Postoperative care is divided into 3 phases: immediate, which is post-anesthesia care; intermediate, which is the hospital stay; and convalescent, which is after discharge. Immediate postoperative care occurs right after surgery, typically in a post-anesthesia care unit or PACU. This phase ensures the patient wakes up safely from anesthesia and begins recovery without complications. Key components of immediate care include monitoring vital signs through regular checks of blood pressure, heart rate, respiratory rate, and oxygen levels. Temperature is also monitored to detect infection or hypothermia. Airway management is critical, involving breathing support with oxygen if necessary. It also means ensuring the airway remains open, especially after general anesthesia. Pain management includes administering pain medications. Patient positioning is also adjusted for comfort and to prevent complications like pressure ulcers. Observation for complications involves monitoring for reactions to anesthesia, excessive bleeding, or signs of shock, such as low blood pressure or rapid pulse. Neurological function is also assessed. Wound and drainage care involves inspecting the surgical site for swelling, redness, or discharge, and ensuring surgical drains are functioning properly. IV therapy provides fluids and electrolytes to maintain hydration. Patients stay in immediate postoperative care until they are stable, alert, and can maintain vital signs independently. They are then moved to a hospital room. Documentation is essential, including postoperative notes and maintaining records for the patient chart and PACU. The intermediate postoperative phase is after the initial recovery period and before the patient is discharged from the hospital. Key components of the intermediate phase include periodic checks of vital signs and adjusting pain medication. Wound monitoring checks for infection, redness, swelling, or unusual drainage. The patient is encouraged to gradually move to prevent complications like blood clots. Nutrition and hydration involve transitioning from liquids to solids and encouraging oral fluid intake. Wound and drain care involves dressing changes as needed and monitoring drains until removal. Medication management includes administering prescribed medications and adjusting them based on the patient's progress. Complication prevention focuses on monitoring for infection, using deep breathing exercises to prevent lung issues, and using compression stockings or anticoagulants to prevent blood clots. Psychological and emotional support addresses anxiety and fears related to recovery. Education is provided on recovery expectations and self-care instructions. Preparing for discharge involves educating the patient on wound care, activity levels, and medications. Follow-up appointments are scheduled, and the patient is educated on warning signs. The convalescent phase is the final stage of recovery, focusing on long-term healing, rehabilitation, and returning to normal activities, often occurring at home. Key components include adequate rest for the body to heal and a gradual, balanced increase in activity levels while avoiding overexertion. Nutrition focuses on a balanced diet rich in protein and vitamins to promote tissue repair. Staying hydrated is important, and prescribed supplements should be taken if needed. Wound and scar care involves continued cleaning and monitoring for infection. Recommended creams or treatments may be used to reduce scarring. Gradual return to activities includes engaging in prescribed physical therapy. Light activities can be resumed as tolerated, but avoid heavy lifting until cleared by the doctor. Pain and symptom management includes taking prescribed or over-the-counter medications. Non-medication methods like heat or cold packs may also be used. Follow-up care includes attending all scheduled appointments to track progress during recovery. Thank you for watching this video on postoperative care.